In the wake of recent global health crisis, stakeholders are sounding the alarm and issuing an urgent call to invest in the health sector. The COVID-19 pandemic, with its devastating impact on lives and economies, has served as a stark reminder of the critical need for robust epidemic preparedness. In this special report, our health correspondent Lois Abba Sambo highlights the collective voices of stakeholders calling for a strengthening of healthcare systems to effectively respond to future epidemics. The report.
It happened. The one thing nobody ever thought could happen eventually did happen. The entire world came to a stop, and not just for a day, but for an entire year. It wasn't a war, it was a disease that the world did not see coming. The coronavirus. Nigeria, like many other countries around the world, had its fair share of the COVID-19 experience.
The Federal Ministry of Health has confirmed the first case of coronavirus disease in Lagos State. The case which was confirmed on the 27th of February.
President Buhari has announced a lockdown of major cities worst hit by the novel coronavirus.
Since the first case was reported in February 2020, the country saw a significant increase in the number of infections, deaths, and economic disruptions. The pandemic exposed the weaknesses in Nigeria's healthcare system and its lack of preparation for such pandemics, as hospitals were not sufficient and the entire nation ran out of supplies, having to depend on organizations and other countries to supply personal protective equipment.
COVID-19 has exposed our gaps in the health sector and in infrastructure and other sectors, and also in our state of preparedness.
With an abrupt lockdown, the pandemic affected the country's economy with widespread job losses, business closures, inflation, and national borrowing.
COVID-19 disrupted global supply chains and, created inflation. And inflation is said to be a tax on the poor. So when you have high inflation, the poor feel the impact the most.
Many Nigerians depend on daily wages to survive and cannot afford to stay at home for extended periods, but the COVID-19 pandemic said otherwise. Maimuna Saleh is a petty trader who depends on her daily trade to feed her children. When the COVID-19 lockdown was announced, her source of livelihood crashed.
Before COVID, I dey buy fruit. I will go orange market, buy fruit and sell it. That time, by the grace of God, that time money dey come. Small. But we call it that COVID. Now everything just ran down. They say lockdown, more we dey for house. Nothing dey move. No, they say anything. We dey for house, children dey, hungry dey. Nothing you go give pikin, go dey cry. Nothing you get wey you go give. That time, suffering too much. They suffer that time well. Because it's so tey, because of that COVID, I no fit sell that fruit again. Won't go back to pure water. Before, why they say orange, they say fruit. That time, like every day. If I go market, I'll buy orange, buy some fruit. At least that time, I used to get like 2,000 a day. If I sell and finish, I get 2,000. But since we don't enter this COVID-19, nothing they move. Now I just go back to pure water. Pure water, if I sell a day, maybe I get 500, sometimes I get 600 a day.
Health is an aspect interwoven with all aspects of life, and when the health sector is not prioritized, every other element of life suffers.
Many of us continue to carry grief in our hearts, grief over those we have lost, grief at the terrible toll the pandemic has taken on families, communities, societies, and economies.
The COVID-19 pandemic has underscored the need for Nigeria to invest in its healthcare system and prepare for future epidemics.
When the next pandemic comes knocking, and it will, we must be ready to answer decisively, collectively, and equitably.
Just like Maimuna, Samari Meyaki was also affected by the COVID-19 pandemic.
The things we do here mostly is savings. We do daily contribution, collecting resources from the public, saving for saving purpose. And at that moment, definitely it strikes us a lot because people will not find it easy to save again, because most of our customers are these business people that go out on a daily basis to work, whatever they get, they come up here, save something small. During this COVID-19, a lot of businesses crumbled because people were not allowed to go into town. There was not access for people to do their usual businesses because government put a law that everybody should be indoor. How do you fund this kind of loan to see how we resettle people back their money? You have to go extra mile to see how we source funds to augment these challenges. I was able to go to Abuja Enterprise. I heard that they are giving grants. I went there, I do the necessary procedures, which I was told I will only be issued 20,000 naira as a grant. I said, what will I do with 20,000 naira? It affected me mentally because to sleep enough like before, it was not there. It affected the health. They even relating with people at work, at home was another different thing because people keep asking, what is happening? Is it because of this? Sometimes we pretend and say, no, nothing is happening. It's well. But within you, as a front runner in the business, we know what was happening because I have to be up and doing to see how I keep this business going. The people resources, the one they have trusted us with, and the one we source from outside to see how we settle problems.
Maimuna and Samari are just a sample out of the millions of Nigerians who lost their livelihood due to the COVID-19 pandemic.
As the popular saying, health is wealth, and the government have the larger responsibility regarding the health of the citizen. Because looking at the environment we operate, the business environments, the health are inseparable.
From personal economies to the national level, the entire economy was affected. Already struggling with a high debt burden, Nigeria had to borrow more funds to help in tackling the COVID-19 pandemic.
COVID-19 was the impact on the economy was very significant. First, it's not a secret that it dragged the economy down into recession. But the initial budget for 2020 had a deficit of 1.9 trillion naira. The revised budget, in consequence of COVID, raised the deficit to over 5 trillion naira. And this was, essentially had to be, borrowed.
With lessons learned from the COVID-19 pandemic, will Nigeria learn from its past mistakes?
Yes, I would say that we have learned a lot of lessons from COVID-19, which we can actually use to respond to other outbreaks should it occur again.
Preparing for an epidemic is not a luxury, but a necessity which will forestall future occurrences like the COVID-19 pandemic.
We need to be prepared as a country. We need to have a plan. What happens when we have pandemic? For instance, we have the NCDC, right? And there's a national action plan for pandemic response. Countries need, and Nigeria needs to, make sure that there are plans in place. These plans need to be funded, right? Because it's not until you have an emergency that you begin to put in place your plan, right? You should have a plan that when you're doing your normal surveillance and when you have outbreaks that you need to respond and things like that. All of those systems needs to be taught right.
The Nigerian government, for the first time, allocated over ₦1 trillion to the health sector in the 2023 budget. Even though this is a significant increase compared to previous years, this only accounts for 5.75% of the total budget, as opposed to the 15% agreed during the African Union Abuja Declaration.
Most at times, when we are doing calculation of the percentage of budget allocation to the health sector, we tend to integrate the provision made for the basic healthcare provision fund. I thought the basic healthcare provision fund is a special intervention in the health sector, and therefore shouldn't have been added as part of the, percentage of the total allocation in the health sector. Because if you look at it, without the basic healthcare provision fund allocation, the total budget spending or allocation in the health sector will not be more than 5-6%, as against the 15% of the Abuja Declaration that we propose.
The Nigeria Center for Disease Control and Prevention is the agency mandated to coordinate activities around disease prevention and control. With a state-of-the-art surveillance system, the agency said it is ready to face any disease outbreak.
Over time and with the advent of COVID-19, we have been able to establish some platform and some institution. For example, we now have our public health emergency operation centers in all the 36 states and FCT. We have across the country a network of public health laboratories that could help us to test some of these diseases out there as well. We have also built human capacity to be able to respond to this outbreak, and those actually informed why we can say yes, we are doing all we can within our capacity to build our readiness and preparedness to any outbreak disease entity. But like I always say, that we are not there, but we are pushing forward to meeting where we can say yes, we are fully ready to respond to any outbreak of disease.
However, there seems to be a gap with the primary healthcare centers, which are the first point of call at the communities.
Over the course of the next 7 years, targeting the SDGs for 2030 and universal health coverage, will be requiring somewhere around 24,461 health workers to close the gaps that we currently have, and about 774 medical doctors deployed to the primary healthcare centers. Contextually, we have to look at the rural areas where these health workers are most needed, compared to a situation where we find most health workers in the urban and peri-urban areas.
The elements of an epidemic preparedness will include ensuring that there is a routine surveillance system that can detect outbreaks as soon as it occurs, and ensure that staff are organized to confirm, investigate, and respond to these outbreaks.
We're looking at what Nigeria needs to do better to prepare for pandemics. So you look at what happens in country, and then you look at what you need to do at the borders because of cross-border transmission. So if you look at the borders as your first line of contact or defense, if you like, we need to strengthen what Port Health Services is doing at the borders and ensure that, the plans that have been developed are properly implemented. Those plans are reviewed as and at when due. There's proper capacity building and collaboration with all the stakeholders at the point of entry. Now, when you come in country, we know that outbreaks begin and end in the communities. We must strengthen that subnational level and ensure that communities are at the center of all our prevention, preparedness, detection, and response efforts. And of course, whatever NCDC is doing must be central to that. So we need to get the states to do more in terms of, commitment to public health efforts.
The Ugandan Ebola experience has shown the importance of epidemic preparedness in any nation.
Both the coronavirus and Ebola outbreaks underscore once again the vital importance for all countries to invest in preparedness, not panic. So far, more than $1 billion has been spent trying to stop Ebola outbreak in DRC. By comparison, just $18 million was spent on preparedness in Uganda. But when Ebola did cross the border to Uganda, they were ready and stopped it. This must be a lesson for the rest of the world.
Having felt the devastating effect of the COVID-19 experience, it is expedient that government prioritizes funding for healthcare and epidemic preparedness. Once bitten by the COVID-19 experience, is Nigeria prepared for a future epidemic, or will she be embarrassed by another disease outbreak?